We meet and we talk about it, and I suppose that itself is an advantage.
They take the mickey out of each other and they crack jokes, and they're just so relaxed and comfortable with it.
Yeah, I had great trouble getting him out to start with. He wouldn't go anywhere, but now that he's joined all these different things, he has this support worker from the Alzheimer's in Salisbury, and she's very good. She comes along once a week and she'll get him to go out. You know, she takes him out to places and they'll go and have a coffee in the garden centre or something. So he gets more of an active life now than he was having.
A diagnosis of dementia can be daunting and raises many questions about the future. Asking for help can feel difficult, particularly if you've always been independent. You might not feel you need it straight away, but it can be useful to know that a wide range of information and support is available to help you live well and stay independent for as long as possible. The main sources of information and support are the NHS, social services, private companies and charities, and not-for-profit organisations. To find services in your area, start by contacting your local memory service or social services department, GP, Alzheimer's Society or Citizens Advice Bureau. Organisations such as Alzheimer's Society can support people with dementia, their families and carers in a range of ways. These include dementia support workers and support groups, telephone helplines and information materials. Lots of different healthcare professionals can support you too, such as community nurses, dietitians and occupational therapists who help people maintain everyday skills. Social care professionals such as social workers and home carers can also offer advice. If you need support at home, the first step is to ask social services for a community care assessment, sometimes called a care assessment or needs assessment. This aims to find ways to help you maintain your independence and quality of life, and will involve a discussion between you and someone from social services. You might also be asked to fill in a questionnaire, which they can help you with if you need them to. To arrange a community care assessment, you or a relative or friend can contact social services directly. Alternatively, a GP, consultant or other professional involved in your care can make a referral. Assessment, information and advice are always free. Social services will appoint someone, usually a social worker, to be responsible for planning your care and support. He or she will draw up a written care and support plan that looks at how they can meet your needs. They may charge you for some services, or they may cover the costs, possibly in the form of a personal budget or direct payment. This is money from the local authority that you use to pay for your care and support. If you have been diagnosed with dementia and are in your 40s, 50s or early 60s, you will have very different interests, care and support needs from someone diagnosed in their 80s or 90s. For example, younger people are more likely to be working or have a partner who is, or have dependent children or possibly dependent parents and still have a mortgage. The number of services suitable for younger people is growing, but progress is slow and services may not be available in your local area. Ask your memory clinic, your consultant, GP or local social services about support and services for younger people with dementia. Contact Alzheimer's Society about putting you, your family or carers in contact with others in your local area or in similar circumstances. Alzheimer's Society online discussion, Talking Point, includes a section for younger people with dementia and their carers, which might also be useful. You might also find it helpful to visit websites and subscribe to newsletters that support people with a particular type of dementia. To find out more about services for people with dementia, visit alzheimers.org.uk/support services. Caring for and supporting someone with dementia can be stressful and at times upsetting. It can also be very rewarding. It is important that you look after your own health and well-being and turn to others for support when you need it.
Alzheimer's had a fantastic course for carers, which I did almost immediately after he was diagnosed. And they did one on finance and one on legal stuff, and then they had all sorts of different subjects. That was brilliant because they taught you a lot, but you could also ask questions. They also had a legal advisor come along and talk to you, and a financial person come along. Any questions that you had were answered there, and if you didn't have a question at the time, you could always go in a few weeks later and they'd find out for you. So it was absolutely brilliant.
Everyone is different, but you might find yourself experiencing a range of emotions at different times. Try and take time to reflect on how you're feeling and talk to someone you trust. You might choose a professional, a friend or family member, or someone at a carer support group. If you use the internet, you could try an online discussion and support forum like Talking Point. Getting support will make it easier for you to cope and better for the person you care for. Sources of support for carers include family and friends, health and social care professionals, memory services, carer support groups, and organisations such as Alzheimer's Society. Looking after your own health and well-being is vital when you're a carer. It is important to make sure that you eat a balanced diet and make time for regular exercise and physical activity. Even going for a walk can help. Make sure you see your GP about your own health on a regular basis. If you're having problems sleeping, ask them for advice. If you feel sad or anxious a lot of the time, talk to them about it as early as possible, as these could be signs of depression. Try to make sure you have some regular time to relax or do something just for yourself. This can have a big impact on your well-being. Try to get out regularly to meet friends. If possible, consider an outing or short break, which can relieve stress and leave you feeling refreshed. Find out about daycare or respite support for the person you care for, so that you can take time out knowing they are well looked after.
But to help anybody with any problem, you've got to realise what they are like as people, haven't you? So one line of help will be more beneficial, say, to you than it would to a friend else.
Much of how you care for the person will come naturally. You will probably know the person the best, and you shouldn't underestimate the value you can bring to their care. It is important to continue to see the person and not just their dementia. When you help out, focus on what they can do rather than on what they can't. For example, lay clothes out for someone to dress themselves, which will help to promote their independence. They may find it hard to remember or concentrate on things, so try to be flexible, tolerant and patient. Allow extra time to do things. Put yourself in their shoes. Try to understand how they might be feeling and how they might want to be cared for. Include them in conversations and activities as much as possible, and make sure they have meaningful things to do, from everyday chores to leisure activities or socialising. Find things to do together if you can. Dementia will affect a person's ability to communicate. In most types of dementia, people will at times struggle to find the right words or follow a conversation. This can be upsetting and frustrating for both you as a carer and the person with dementia. Ensure that you make eye contact and listen as carefully as you can. Notice your body language and think about how you use gestures, facial expressions and touch. Try to speak clearly, and if you aren't being understood, use simpler words or explain things differently. Bear in mind that other things, and not just dementia, can affect communication, like hearing or eyesight problems, pain or side effects of medication. If it feels right, it can sometimes help to deal with misunderstandings and mistakes using humour, but you will need to judge how the person responds to this. At times, people with dementia behave differently from how they used to. Some behaviours can be particularly unusual or challenging. Behaviours which might seem unusual include asking the same question or repeating an action over and over, restlessness like pacing or fidgeting, lack of inhibition such as socially inappropriate behaviour in public, and thinking someone has taken something belonging to them when they've actually mislaid it. More challenging behaviours include the person becoming very agitated or shouting out, perhaps in a response to a hallucination. The person may also be physically or verbally aggressive. While it can be very difficult, it's best to deal with any potentially tense situations as calmly as you can. Keep in mind that even where behaviour appears to be targeted at you, this may be just because you are there. Symptoms might be caused by a curable health problem, such as pain or discomfort due to constipation or an infection. See your GP if you suspect this might be the cause. Sometimes the behaviour is really the person trying to communicate an unmet need, for example, that they are bored or frustrated. If problematic behaviour persists or causes distress, seek advice and support from your GP, memory service, community mental health nurse, or Admiral nurse, who are mental health nurses who specialise in dementia. If the behaviour persists and you're not in contact with a dementia specialist, ask for a referral. Sometimes the doctor might suggest medication. This may be one of the drugs mentioned in the treatments film. If these do not help, your doctor may recommend an antipsychotic drug. If so, talk to the doctor about the benefits and risks. These drugs don't work for everyone and can have serious side effects. To find out more about support for carers, visit alzheimers.org.uk/carers. Alzheimer's Society is the UK's leading support and research charity for people with dementia, their families and carers. We provide a range of services and resources to support people affected by dementia. We have national services that are available wherever you live in England, Wales and Northern Ireland. These include the National Dementia Helpline, Talking Point, an online discussion forum, and our range of information resources for people affected by dementia, as well as health and social care professionals. We also offer services locally. These vary depending on where you live and where funding is available. Services include dementia advisors, dementia support workers, dementia cafes, singing for the brain activities, support groups for people with dementia, and support groups for carers. Also available are advocacy services, daycare and home care, and the Carer Information and Support Programme. To find out more about our services, please phone the National Dementia Helpline on 0300 222 1122 or visit alzheimers.org.uk.